Injury Comeback Strategy Gradual Training. Title: Injury Comeback Strategy, The Power of Gradual Training. Introduction. Injuries are an unfortunate reality that many athletes and fitness enthusiasts have to contend with at some point in their journey. Whether it's a strained muscle, a ligament tear, or a stress fracture, injuries can be debilitating and frustrating. However, one key aspect that can make or break a successful comeback is the approach taken to rehabilitation and training post-injury. Among the various strategies available, the concept of gradual training has gained significant traction due to its effectiveness in aiding recovery while minimizing the risk of re-injury. In this article, we delve into the principles of gradual training as an injury comeback strategy and explore its benefits for individuals looking to regain their strength, mobility, and performance. Understanding gradual training. Gradual training, often referred to as progressive overload, involves incrementally increasing the intensity, duration, or volume of training over time. This approach contrasts with the all-too-common tendency to jump back into workouts at pre-injury levels, which can exacerbate the injury or lead to new problems. Gradual training acknowledges the body's need for a careful transition and adaptation period, allowing injured tissues to heal, strengthen, and gradually regain their former capabilities. The science behind gradual training. The foundation of gradual training is rooted in physiological principles that govern tissue repair and adaptation. When an injury occurs, the body initiates a complex healing process involving inflammation, tissue remodeling, and eventually strengthening. Attempting to rush this process through aggressive training can disrupt the delicate balance and increase the risk of re-injury. As tissues heal, they undergo a process known as tissue remodeling. This involves the realignment and strengthening of collagen fibers that make up tendons, ligaments, and muscles. Pushing these tissues too hard, too soon, can disrupt this remodeling process, leading to suboptimal healing and weakened structures. Furthermore, neuromuscular adaptation is another crucial aspect of gradual training. After an injury, neuromuscular pathways may be altered, affecting coordination and movement patterns. Gradual training allows the nervous system to adapt and relearn these movements progressively, reducing the risk of compensation patterns that can lead to chronic issues. Key components of gradual training. 1. Consultation and evaluation. The journey back from an injury should ideally begin with a consultation from a qualified medical professional. A thorough evaluation will help determine the extent of the injury, gauge tissue healing progress, and provide guidance on when to start training. 2. Start with mobility and stability. The early stages of gradual training should focus on restoring joint mobility, muscle flexibility, and stability. These low-intensity exercises help prevent further stiffness and maintain proper joint mechanics. 3. Individualized progression. Every injury is unique, and so is every individual's healing process. Gradual training should be tailored to the specific injury and the person's overall fitness level. A physiotherapist or sports rehabilitation specialist can guide this individualized progression. 4. Mindful loading. Gradual training emphasizes the importance of loading injured tissues in a controlled manner. This could involve resistance exercises, bodyweight movements, or low-impact cardiovascular activities. The key is to start with a load that challenges but does not overwhelm the healing tissues. 5. Monitoring and adjusting. Regular assessments of pain levels, range of motion, and overall discomfort are essential during gradual training. Adjustments to the training plan can be made based on how the body responds to each phase of the program. Benefits of gradual training. 1. Reduced risk of re-injury. The primary advantage of gradual training is its ability to mitigate the risk of re-injury. By allowing tissues to gradually adapt, the likelihood of overwhelming the healing structures is significantly reduced. 2. Enhanced tissue remodeling. Gradual loading supports optimal tissue remodeling by allowing collagen fibers to align properly. This results in stronger, more resilient tissues that can better withstand future stresses. 3. Neuromuscular re-education. Injury often disrupts the body's movement patterns and coordination. Gradual training aids in re-educating the nervous system, promoting more efficient movement patterns and reducing the chances of compensation-related issues. 4. Psychological confidence. Returning to training after an injury can be mentally challenging. Gradual training provides a structured approach that builds confidence and reduces anxiety about re-engaging in physical activity. 5. Long-term performance. Patients during the comeback phase can have lasting benefits. By prioritizing gradual training, individuals can lay a foundation for long-term performance improvements and injury prevention. Case study: the marathon runner's return. Consider the case of Sarah, an avid marathon runner who suffered a stress fracture in her lower leg. Devastated by the setback, she was determined to make a successful comeback. Working closely with her physiotherapist, Sarah followed a gradual training program. Initially, her training consisted of gentle range of motion exercises, focused on maintaining joint mobility around the injured area. As the weeks progressed, she incorporated low-impact activities such as swimming and stationary cycling. These activities allowed her to maintain her cardiovascular fitness without compromising the healing process. After several months, Sarah began introducing light resistance training to her routine. Bodyweight exercises like squats, lunges, and modified push-ups were included, with careful attention paid to any discomfort or pain. Her physiotherapist monitored her progress closely and adjusted the exercises as needed. Over the course of nearly a year, Sarah's gradual training approach paid off. She eventually returned to running, starting with short, controlled sessions and gradually increasing her mileage. By respecting the principles of gradual training, Sarah not only completed her comeback successfully but also found herself stronger and more resilient than before the injury. Conclusion: